first question, number one, this question actually came from Jenny Reyes, who said, hey, Dr. Islam, I've had resistant H. pylori multiple different times. What can I do to get this taken care of? So let me know if you've heard about this condition called H. pylori. Very common condition. A lot of people have this. Let's talk about this. So H. pylori is a bacterial infection inside the stomach that can cause a lot of gut issues. It can cause indigestion, pain, but it can also cause ulcers. It can cause inflammation, and there is a risk of this H. pylori causing lymphoma or cancer of the stomach. In fact, H. pylori is one of the leading causes of both ulcers and cancer of the stomach. And people get H. pylori typically from having food or being around environments that's not very, very clean. And you may get this, and it may be with you for quite some time and not cause any issues, but there may be some triggering event, which we're not quite sure about, that can cause this H. pylori to become active and cause the issues that you're having. So if you've had H. pylori, there are a couple different ways we can test for this. Sometimes we'll have you breathe into a machine to see if you have the active infection. Sometimes we will, yes, actually sample your stool. But yes, we actually do that. But other times I can actually take a look with the scope, see what's going on, and take biopsies of your stomach to see if you have this infection that's there. Now, when we give treatment for this, we typically give a round of antibiotics. But what we have found with the prevalence of antibiotic resistant drugs or bacteria from the prevalent use of antibiotics, the treatments that we used to use for H. pylori do not work as well as what we would like. The eradication rate, the rate of getting rid of H. pylori has gone down, meaning there are so many patients who've had H. pylori in the past, get treated, and they still have the infection because the bug is resistant to the traditional antibiotics that we use. So what do we do? Well, a couple things. Number one, we have a lot of medications that are coming out and that are currently here that we're using for resistant H. pylori. So sometimes we'll give a different set of antibiotics to help get rid of the infection, and by doing that, we can hopefully eradicate that. For other people, we actually may take samples of that bug and look at it under a microscope to see which antibiotics it is sensitive to. We actually will see this, that way we can tailor the treatment towards that particular person to see what we can do for that. But sometimes it's a matter of guessing which antibiotics we should use and which ones we shouldn't use. So one of the most important things that you can do is make sure you don't take any unnecessary antibiotics, because this can set you up to have not only a bad microbiome, but also set you up, if you have H. pylori, for this to be a problem for you in the future. All right, great question that I got.